Hi, everyone. Thank you for the opportunity to present in front of you today. Carp, as many of you may know, is a national not-for-profit, nonpartisan organization with 320,000 members in every province and territory across Canada. I think it's also important to distinguish that while most of our members are retired and enjoy above average education and income, an overwhelming majority consistently report that Carp represents the interests of all older Canadians across Canada. We believe that all older adults deserve to live in dignity and with respect, regardless of income level, family support, and health challenges. COVID-19 has undermined these fundamental principles of aging well and revealed a lack of planning and preparation that would secure the health and well-being of seniors during a pandemic. Carp has been actively engaged with our membership since the onset of COVID-19 in providing credible and reliable information to older adult populations on our website through programming and via surveys that we conduct to better understand our members' needs and concerns. We hosted 3 virtual town hall events, each with a reach of up to 12,500 members, to provide them with a forum to ask their specific questions from trusted experts on matters related to health and finance. These sessions were recorded for television and aired on our media networks across Canada. What we've heard largely from our members, apart from the obvious human consequence, is that seniors have been negatively impacted by an increase in the cost of living from grocery premiums and delivery fees, an increase in prescription medication fees, a lack of free or discounted community services, whether that's laundry services, meals at community centers, volunteer tax preparation, all which closed down due to physical distancing restrictions. In addition, as you know, stock markets have taken a plunge and many seniors have seen significant declines in their retirement savings. In a survey pre-COVID, the majority of our members had already expressed that they were concerned about outliving their savings in retirement. With the recent economic impacts of COVID-19, these fears have really never been more real. While we understand that the government's initial economic response was to quickly address income replacement, several weeks have passed and there have been no meaningful announcements around addressing the financial concerns of seniors. Retirees, as you know, are ineligible for CERB. While the 25% reduction in the minimum RIF withdrawal was welcome, it was not retroactive, and many would rather leave their savings untouched given current market volatility. Additionally, the $9 million that was earmarked for seniors and provided to United Way was met with confusion on how to access it. Our own call centers and those of United Way's 211 service have been flooded with calls to better understand how that $9 million was to be distributed and accessed. I'd also like to speak to what my colleague was speaking about earlier from Caltech, and that's to a more urgent piece around how we care for older adults, particularly in congregate settings and long-term care. If COVID-19 has revealed anything, it's revealed the following: that we warehouse frail and very ill seniors in unsafe situations which are underfunded, understaffed, and often with little or no certified training. And we expect individuals and their families to pay a significant part of the privilege to be in those facilities. It is unconscionable that of 4,900 deaths in Canada so far from COVID-19, 82% were from a population whom we are duty-bound to protect, and we failed them. And this is not the responsibility of the federal government alone, but it is the duty of the federal government to make sure it doesn't happen again. If we've learned anything, it's that we didn't have a real plan in place for seniors in long-term care in this kind of pandemic, in spite of having advanced warning from other countries, seeing previous crises of similar scale like SARS and MERS, and the experience with seasonal flu that spreads in these settings and claims seniors' lives annually. These are our most vulnerable residents. We can and we must do better. Thank you.